Every single day, millions of people wake up and take a small pill called Gabapentin. Maybe that's you. Maybe it's someone you love. Your doctor prescribed it. They said it would help. And maybe it did. But here's the question nobody asks in that appointment room. Did your doctor tell you everything? Not just the benefits, not just the basics, but the real stuff. The side effects that often get skipped. The things that don't make it onto the little paper they hand you at the pharmacy. Today, we're going to talk about 5 major side effects of gabapentin that doctors don't always explain. And more importantly, we're going to tell you what you can actually do about them. Stay with us. Because number 3 genuinely surprised even medical researchers. So first, let's get clear on what gabapentin actually is. In simple terms, it's a drug that calms down overactive nerves in your brain and body. Think of your nerves like electrical wires. Sometimes those wires fire too much, too fast. Gabapentin slows that down. Doctors prescribe it for a lot of things. Nerve pain, epilepsy and seizures, restless leg syndrome, sometimes for anxiety or sleep. The list keeps growing. And here's how common it really is. Gabapentin is one of the top 10 most prescribed drugs in the entire United States. Hundreds of millions of prescriptions are written every year. That's not a small number. That's a massive number of people trusting this medication every single day. It helps a lot of people. That part is real. But there are some things you need to know. Things that often don't come up in a 10-minute doctor's appointment. And that's exactly why we're here today. Side effect 1. Brain fog end.Gabapentin. Memory loss. Here is something a lot of gabapentin users notice. They walk into a room and forget why they came. They lose their train of thought mid-sentence. They feel like their brain is wrapped in a thick cloud. And the scariest part? They think it's just stress, or age, or tiredness. But it's not always that. Gabapentin works by slowing down signals in your brain. That's the whole point. But your brain doesn't separate the pain signals from the memory signals. It slows everything down. And that includes your ability to focus, recall names, and think clearly. Studies have shown that gabapentin can reduce attention span and slow memory recall. Older adults feel this the hardest. People on higher doses feel it even more. You are not going crazy. You are not getting old overnight. This is a real, documented effect of the drug sitting in your medicine cabinet. Talk to your doctor. A simple dose adjustment can sometimes make a massive difference. Side effect 2. Weight gain. end.Gabapentin. Swelling. You started gabapentin. A few weeks passed. Then you noticed your pants feel tighter. Your feet look puffy. Your ankles are swollen by evening. You think maybe you ate too much. Maybe you're not moving enough. You blame yourself. But here's what's really happening. Gabapentin does 2 separate things to your body. First, it increases your appetite. You feel hungry more often. You eat more without realizing it. Second, it causes fluid retention. Your body starts holding water, especially in your legs and feet. Doctors often skip this side effect because compared to treating seizures or severe nerve pain, a little weight gain seems minor. But it's not minor to you. It affects how you feel in your body every single day. In the long term, it can affect your mobility, your heart, and your confidence. This is not laziness. This is your body reacting to a medication. The good news is simple awareness helps. Light daily movement, watching your salt intake, and an honest conversation with your prescriber can go a long way. Side effect 3. Mood end.Gabapentin. Mental health changes. This is the one that shocks people the most. And honestly, it shocked researchers too. Gabapentin is supposed to help you feel better. Less pain. More rest. Better quality of life. But for some people, something unexpected happens. Their mood starts shifting. They feel low for no clear reason. Anxiety creeps in. In some cases, dark thoughts appear, thoughts that were never there before. The FDA has an actual warning about this. Gabapentin can increase the risk of depression, anxiety, and suicidal thoughts in some patients. That warning exists. But how many patients actually hear it clearly from their doctor? Not enough. Children and teenagers are especially vulnerable. Behavioral changes, mood swings, and emotional outbursts have all been documented. Here is the dangerous part. Most people don't connect their mood changes to their medication. They blame life. They blame stress. They wait too long before saying something. Please don't wait. Track your mood week by week. Write it down if you have to. And the moment something feels off, tell your doctor immediately. This side effect is serious, and it deserves to be treated seriously. Side effect 4. Physical dependence and withdrawal. Here is one of the biggest myths about gabapentin. Doctors often say it is not addictive, and technically it is not classified as a controlled substance in many places. So people assume they can stop whenever they want. That assumption can be dangerous. Here is the truth. Your body adapts to gabapentin. Over time, your nervous system adjusts to having it. It starts to rely on it. So when you suddenly stop taking it, your body doesn't know what to do. And it reacts hard. Withdrawal symptoms can start anywhere from 12 hours to 7 days after stopping. Anxiety spikes. Sleep becomes impossible. You sweat. You feel restless. In serious cases, people experience seizures. Yes, seizures. From stopping a drug that was sometimes prescribed to prevent them. Documented cases exist of people developing dependence even while taking gabapentin exactly as prescribed. This is not about misuse. This is about biology. Never stop gabapentin cold turkey. Always work with your doctor to taper down slowly. Your body needs time to adjust. Give it that time. Side effect 5. Breathing problems. This is the most underreported side effect on this entire list. And it is also the most dangerous one. Gabapentin slows down your nervous system. That is its job. But your nervous system also controls your breathing. And when gabapentin slows things down too much, your breathing slows with it. On its own, this risk is manageable. But here is where it becomes life-threatening. When gabapentin is combined with opioid painkillers or alcohol, the risk of severe breathing problems skyrockets. The UK's Medicines Authority issued a specific safety warning about this exact combination. Real people have been harmed. Real people have died. The groups most at risk are elderly patients, people with asthma or COPD, and anyone taking other medications that affect the nervous system. And the terrifying part is this. Many people are prescribed gabapentin alongside opioids for pain management. These two drugs are given together all the time. But the full risk is not always explained. This is not meant to scare you. It is meant to protect you. Tell your doctor every single medication and supplement you take. Every single one. That information could save your life. Let's take a breath. Because we just covered a lot. Gabapentin is not a bad drug. It has genuinely helped millions of people live with less pain, fewer seizures, and better sleep. That is real and that matters. But you deserve the full picture. Not just the benefits. The risks, too. Because knowing the risks does not make you a scared patient. It makes you a smart one. So here are 3 simple things you can do starting today. First, keep a symptom journal. Write down how you feel each week. Brain fog, mood, weight changes, anything. Second, never stop gabapentin suddenly. Always taper slowly under your doctor's guidance. And third, have an open and honest conversation with your prescriber. Ask the questions this video raised. You have every right to ask them. Your health is yours. Own it completely. If this video helped you understand something your doctor didn't explain, share it. Send it to someone who takes gabapentin. It might be exactly what they needed to hear today.